So the main causes of a blocked nose are inflammation. Um, this causes swelling in the lining of the nose, and the inflammation is what we call rhinitis. So this inflammation causes excess mucus production, which is otherwise known as snot. It also causes what we call turbinate hypertrophy and loss of function, which in this sense is a loss of sense of smell. Now, the space between your septum, which is in the midline, and the turbinate, which is on the other side, is what determines what airflow is, and this is what we call the valve. So the more space there is, the better you can breathe. Now, the turbinates are structures inside of the nose which help to warm, filter, and moisten the air that you breathe in. If the turbinates are swollen, which is what we call turbinate hypertrophy, there is less space for the air to flow, and your nose feels blocked. Likewise, if there's excess mucus in that space, there's also restriction to airflow and your nose feels blocked. So the most common causes of this inflammation are infection, like viruses, as well as allergies. So deviated septum is another cause, and this happens when there's obstruction, again, at the nasal valve. So if the septum is in the wrong position, that causes an obstruction of the airflow. So the septum is a thin piece of cartilage and bone which acts as the midline partition between your right and your left nostril. So it's right in the middle. And a deviated septum can happen because of trauma, or sometimes one is just born that way, or sometimes the nose just develops abnormally with time. Another thing that can cause a blocked nose is nasal polyps, and these are usually benign swellings in the nose that can also cause obstruction of the airflow. So this depends on the underlying cause, but broadly speaking, the treatment is either medical or surgical. Now, likewise, the medical treatment can be short-term or long-term. Now, short-term medical treatment includes over-the-counter sprays, decongestant sprays, which would not be used for more than 5 days. Now, these work by reducing the swelling temporarily to provide symptomatic relief. Saline rinses are also very useful as they wash the mucus or wash the allergen, which is causing the swelling, away. Now, long-term treatment, on the other hand, can include steroid nasal sprays or steroid drops, which reduce inflammation. Now, both the swelling and the excess mucus production are reduced with this. These aren't usually available over the counter and are usually prescribed by a doctor. Conversely, you can, on the other end of the spectrum, you have surgical treatment, and that can include turbinate reduction if you have turbinate hypertrophy, for example, or coblation, for example, coblation turbinoplasty, or septoplasty or septorhinoplasty to correct a deviated septum. Another type of surgical intervention would be endoscopic polypectomy. Yes, it's perfectly okay to use saline nasal sprays every day. In fact, we recommend that they are used every day. So you should see a doctor if the treatment that you have tried isn't working. There's also what we call red flag symptoms. For example, if the blocked nose is just on the one side, if there's bloody discharge, again, on the one side especially, if you have any sort of eye signs, like if your eye is protruding, or if you have double vision or loss of vision, or likewise if you have any bad smells coming from the nose. These are a few examples of when you should see a doctor. So there's quite a few over-the-counter remedies available for a blocked nose. Sometimes people find it soothing to breathe in steam or vapors such as menthol and eucalyptus. Saline nasal sprays and rinses are also recommended. The decongestants which are available over the counter are also good short-term, but if you overuse them, for example, more than 5 days in a row, they can cause more problems than what you started with. So it's really recommended that you don't use it for more than 5 days. Now, there are also some weak steroid sprays which are available over the counter, which, along with antihistamine tablets, are useful for the allergic type of swelling that you get in rhinitis. Of course, no over-the-counter remedy is going to help with a condition that requires surgery, like a septal deviation or a nasal polyp.